Good afternoon, everyone. It's Friday, the 13th of November, Friday the 13th, and I'm here with Heywood Healthcare's COVID-19 update, and I have a couple folks that are going to follow me with some presentations as well, just to mix it up a little on our Friday and get you ready for the weekend. But first, let's go right into our numbers, which I know is on the forefront of many people's minds. At Heywood to date, we have tested 32,435 tests. That represents 31,292 negatives, 761 positive. Our cumulative rate throughout the pandemic is just now a smidge underneath the state at 2.4% versus the state at 2.5%. And our 7-day rolling average positive rate, which really gives you a sense of the pandemic right now, we are now tied with the state at 2.9%. So we have brought our, at least for this moment in time, brought our positive rate down a little bit, and we need to keep doing that, as we've discussed time and time again on these videos, that we need to all do our part to make sure that the disease load is lower in our community so that we can take care of everyone and function as a society. So please be super careful, especially as we're going into the weekend. I know there's a proclivity of getting together and socializing, but please, we really need to keep small in our own little bubbles and in our own families, and make sure we're wearing our masks when we're out and about, washing our hands, practicing social distancing, all those right things that made us a leader in the Commonwealth at keeping COVID-19 at bay early on. So a shout out to everyone for that, to continue doing that, and also to make sure that your friends and family are doing the same thing. There's some stats embedded, so the latest update on town by town of the positive COVID-19 findings, and I think that'll be good for everyone to see. Also want to let you know that this morning I had the honor of being on North Central Chamber of Commerce Good Morning North Health program, North Central program, along with the presidents of several other hospitals, Steve Roach from Health Alliance, and Christine Schuster from Emerson. And it was really a nice program where we got to talk a lot about what is going on. And the number one theme that came out when we were asked what could we be doing to make sure that we keep everything under control in our region, and the theme was resist complacency. I know we all want this to be over, and that we just are not really enjoying everything that we need to do the right thing. But especially as we come into the holiday season, we're spending less time outdoors. We all need to recommit to safe practices to keep COVID-19 at bay as we await for the release of vaccines that in the new year, sometime in the new year, that will help us further bring the pandemic under control. I also just want to let you know that we have been working, there's a group of us from the Gardner region that have been working for about 5 years to increase our Boys and Girls Club programming in our community. We are a community that does not have a YMCA, a YWCA, nor a Boys and Girls Clubhouse, but we have Boys and Girls programming through the Leominster-Fitchburg Club, and it is our dream at some point in time, a couple of years from now, that we will be able to open our own land-based clubhouse, possibly at the Waterford Street School, which the city is planning to offer us. And so we do usually have a big live fundraiser in the fall, this time of year, that fully underwrites our educational programming and enrichment programming for the whole school year, and also helps us build up a capital fund for a future clubhouse. So there's going to be a link embedded with this as well. I encourage you to hop on and look at the great auction items that your community friends have put together to support the Boys and Girls Club in Gardner, and perhaps bid high and bid often as we support kids in our region. With that, I'm going to turn this over to Dr. Helen Heneghan, who is our Chief Medical Officer, who's going to give part of the weekly update, part of our rotation of the senior team through weekly updates, so that you get to see the faces and the names of people who are helping lead our health system. Following her is going to be Janine Lohr from our diabetes care. She's our diabetes care and education specialist, and she's put together a thoughtful video in recognition of National Diabetes Day, which is celebrated in November, which is National Diabetes Month. So with that, I'm going to turn it off to Dr. Helen Heneghan, who will help us continue our journey to be one of the best community-owned health systems in America. Have a great weekend, everyone.
Hi, I'm Dr. Helen Heneghan. I'm the Chief Medical Officer for Heywood Healthcare, and I'm here to give our weekly report and a COVID update. I have brought a couple of my colleagues with me who are active on the floors at Heywood. I'd like to introduce them now. Before I go there though, I would like to talk a little bit about COVID fatigue. All of us are feeling COVID fatigue at this point. I know that everyone in the community is also struggling with COVID fatigue. We're making efforts to help our staff cope with some of this COVID fatigue. Annette.
Yes.
How are you helping our staff, with COVID fatigue?
I'm actually trying to help the leadership group a little bit with COVID fatigue. I tried to start an initiative of lifting up our Monday mornings we have Monday morning huddles with all of leadership and a senior team. So I decided maybe it would be fun to give us some fun goggles or a fun nose to wear on our Zoom meetings. And it's created quite a few laughs, and it's changed our Monday mornings greatly at this point. So I think it's been quite the success.
Definitely has, Annette. Thank you for that.
You're welcome.
Karen, tell us how people are feeling the fatigue on the floors.
So I'm over the ICU and Watkins 1 where we have all of our COVID patients. Our ICU staff not only take care of your loved ones when they're in the ICU, but they also go home and they have to now teach their children. As we know, many of us have our kids at home doing on Zoom classes and things like that. So imagine working a full night shift and going home to teach. Some of the things that we're doing, number one, listening to the staff. We also have our Oasis room, which we started in the spring. Thank you to our leadership here. And we keep that stocked with some little gifts, some snacks. It's a place they can go and actually take their mask off and relax for a little while. There's water there for them, and this is provided by the hospital. So that's how I'm keeping some of the ICU and the Watkins 1 team kind of out of balance.
Thank you. Thank you very much. I'm going to let these guys go back to work. I put them on the spot today, and then we'll go through some of our announcements. Thank you very much. Thank you very much to Karen and Annette. They're very strong leaders on our floors, and we appreciate everything they do, as we appreciate everything all of our staff do. By the way, today is World Kindness Day. Everyone, reach out to your friends. Let's be kind. Let's remember how to be kind through these difficult times. Other thing of note today is that it's National Radiology Tech Week. We've been celebrating it all week, and we're very thankful for all they do. They are behind the scenes, but so important to the functioning of the hospital. I'd just like to remind everyone how important it is to wear a mask. I know that sometimes it's easy to take them off or wear them below your nose, but Governor Baker issued an order effective November 6, 2020, requiring face masks or cloth mask coverings in all public places, even when we're able to maintain 6 feet of distance between each other. Watch those masks, please. Make sure you're wearing them. Thank you very much. Please remember to wear masks in the cafeteria unless you're eating. Make sure you maintain 6 feet from the next person. If you're sitting at a table, make sure there are the maximum number at a table, which I believe currently is 2. Do not pull over chairs and sit next to your friends. We have many open jobs currently at Heywood Healthcare. There's a list of jobs available on our website. Please make sure you share this with friends and family. And you can go to www.heywood.org/careers. Lastly, there are lots of providers in our community that are accepting new patients. We will have more telemedicine available for anyone that's uncomfortable coming to the office. And we are very careful about hygiene in our offices. Thanks, be kind, have a wonderful weekend. See you next week.
Hello, my name is Janine Lohr. I am a certified diabetes care and education specialist. November is Diabetes Awareness Month. Heywood Endocrinology, Diabetes Education, and nutrition therapy would like to take time to bring awareness to the epidemic that is diabetes. Among the U.S. population, crude estimates from 2018 indicate that 34.2 million people of all ages, or 10.5% of the U.S. population, live with diabetes. 7.3 million more adults, age 18 or older, meet the laboratory criteria for the diagnosis of diabetes, but are unaware that they have it. Among adults, about 1.7 million new cases of diabetes are diagnosed each year. If this trend continues, as many as 1 out of every 3 adults in the United States could have diabetes by 2050. In 1993, Massachusetts saw 3.9% of the population living with type 2 diabetes, and by 2015, 8.9% lived with the disease. Diabetes affected more than double of the Mass residents by 2015. Our local counties report the following rates: Worcester County, 9.8%, Franklin County, 9.1%, and Middlesex County, 8.2%. Diabetes is the leading cause of kidney failure, non-traumatic lower limb amputation, and new cases of blindness among adults. It is also a major cause of heart disease and stroke, and the 7th leading cause of death in the United States. People who live and manage diabetes daily are warriors, true warriors. What other disease requires you to obtain a blood specimen, interpret the results, and make a medication dosing decision? That's what our warriors do every day when they live with diabetes. What does a day with diabetes look like? You wake up, stick your fingers, squeeze, test, calculate, dose, eat. Take care of your family, go to work. Is my sugar too high? Am I too low? Lunchtime, test, calculate, dose, eat. Snack at work, test, calculate, dose, eat. Am I too high? Am I too low? Is my glucose in range so I can exercise? Can I afford my meds, my test strips? Plan, calculate, decide. Hope. Hope comes in many forms, and although there is not a cure for diabetes, research has discovered better tools, better medications, and educational programs to help you manage your diabetes. The team at Heywood Endocrinology, Diabetes Education and Nutrition are here to help you identify the tools, medications, and behaviors that will help you manage your diabetes and keep you healthy and free from serious complications. Our team will help make the diagnosis of diabetes seem less overwhelming and something you can succeed at managing.